Good morning. Welcome back. You're still watching Daybreak on this 11th day of March 2024. In studio, I have panelists. I have Mheshimiwa Robert Mbui, Member of Parliament for Kathiani constituency. Someone is telling me to say Mbui. Good morning.
Good morning, Sam.
I have Mheshimiwa David Ocheng from Ugenya constituency. Good morning.
Good morning, Sam. How are you doing this morning?
I am well. Karibu sana to the show. And Fred Okango. Mheshimiwa wapi?
Mheshimiwa Kibra.
Soon.
Political Affairs Secretary at the Independence Party, KANU, and we're still expecting the Senator of Murang'a, as soon as he's able to join us, we'll be bringing him on board to have a conversation this morning. And we're waking up to the dailies. Sexual abuse in school is the main story on the Daily Nation. A host of secondary school students are suffering in silence as sex predators, including their classmates and teachers, pounce on them, with their complaints often being ignored by their own parents. Who will stop this silent epidemic? Then there's the battle for ODM Soul, Joho versus Oparanya. The two camps that you can see there, the Oparanya camp, and then there's Joho camp. The battle to succeed ODM Chief Raila Odinga is on, with two factions beginning to emerge. One is allied to former Mombasa Governor Hassan Joho, while the other is led by former Kakamega Governor Wycliffe Oparanya. And Mr. Joho yesterday hit the road running, holding talks with some ODM members in his camp as he made preparations to launch his nationwide campaign. On the Standard, staring at a disaster, doctors are going on strike if their demands are not met. Ministry of Health officials are hesitant to post interns who make up almost 30% of the workforce. As the calls for dialogue grow louder, Kenyans will yet again bear the brunt of the strike. And so much has been going on in the health space, including the consideration of the SHIF regulations. We also know that there has been a conversation about when it should commence. That is the rollout of the new health insurance scheme. The Cabinet Secretary is saying that the deductions will begin in March, but the services will commence come the month of July, that is later this year. And that is where I want us to begin by talking about that. Honorable Mbui, I think I spoke to you some time last week because you sit at the Delegated Legislation Committee, and what the Cabinet Secretary said, and you'll be listening to what he said in terms of the confusion on when contributions begin or when the services begin, because that has been changing quite a lot. And as soon as that clip is ready, we'll be listening to it. But Honorable Mbui, talk to me about, there's so much work to be done. The regulations talk about some 90 days of registration. Are we ready to roll out now?
Yeah, thank you, Sam. Sam, I think these regulations and the plan on this universal health care coverage under the Social Health Insurance Fund seems to have a lot of confusion. As a member of the Delegated Legislation Committee, we had a meeting with the CS and her team. And the regulations were, highly flawed. And we decided and agreed that they have to make very major changes. I'm surprised when the CS now talks about rolling it out. Starting collections at the end of March, because the initial regulations that were presented to the committee, Regulation 10 talks about registration, and they're registering every Kenyan. Every Kenyan. So you're talking about, millions, over 50 million of us need to be registered before they can commence, the operation of this fund. And the deadline that was given for registration, which of course we also questioned, because you don't have a deadline for registration because registration must be ongoing. They had given a deadline of 30th of June. And then they said that they will start operation and also contribution from the 1st of July. So these regulations, after discussion, I'm just seeing these in the media, I'm hearing the CS talking things that are totally against what we agreed on. So I don't think they would be ready. Sam, the reality is this. You cannot start collecting money, because I think the problem is the obsession, this Kenya Kwanza administration of collection of money. You cannot start collecting money for a fund which is not ready to even be rolled out. it is common sense that the first thing you do is register people, and then you come up with the regulations that are, that are approved by Parliament that show exactly how you collect money and how that money will be spent. Now, Kenya Kwanza administration through the CS now want to start collecting money because the money they would collect under the Social Health Insurance Fund is much, much more than what they are collecting under the current NHIF. So basically, I think the idea here is a preoccupation with just getting money out of Kenyans' pockets. If they were to be fair, they would first roll out the registration process. And Sam, let me tell you, even the registration process that they had set out to do up to the end of June, I don't know whether they'll be able to achieve it. Because some are talking about... I'm talking about over 50 million Kenyans because they are registering everybody. Every Kenyan will be a member of Social Health Insurance Fund. Every Kenyan, whether a contributor or a beneficiary. So every single Kenyan has to be registered. You have less than, about 100 days now. Now, 100 days to register over 50 million Kenyans. That means we are talking about 500,000 Kenyans per day. How will they be able to do that? So that there's already, it's a completely flawed process. I think they needed to take time, think through. And then some, I want to just remind the CS that Article 94 of the Constitution, Part 5, talks about no person or body has the power to, to make provision that has a force of law except Parliament. So the only thing that the CS is allowed to do is come up with the regulations, but then present them to Parliament for approval.
So that you said you had a session with the Cabinet Secretary and the Ministry of Health officials, and you gave recommendations. What should happen between those recommendations and the time that the ministry is able to roll them out?
The ministry must, as we are talking now, there are no regulations. The ministry must make the regulations, and then they gazette them, and then they present them to Parliament. And after which now Parliament will make a decision. And I'll tell you this, Parliament can announce the regulations, which means then they don't become effective. So I don't see how the minister can be talking about a collection of money yet before we have these regulations in place. We don't have regulations as we are talking. What they had were proposed regulations, which they themselves said they're going to change. So we haven't seen the changes. So I don't know why the CS is still talking about it. I think they need to go back to the drawing board, set up the regulations properly, and then present them to Kenyans so that we can also take them through public participation. Some, regulations must also be discussed, just like any legislation that comes through Parliament. I would be keen to know, after we had a meeting with the ministry, when did they suddenly decide that I think 31st of March is a day to commence collections? Where did that come from? Who did they discuss that with? Because we didn't discuss that. We only discussed the dates that they had given us. So I think the appetite for our money needs to be put aside first so that we can come up with the regulations that can help this country. Okay.
Let's listen to the Cabinet Secretary on the different messaging she's been treating the country to.
Once they are gazetted, they come into effect. So that means then deductions begin end of the month, end of March.
And this is 2.75%?
2.75% of income. What Prof had desired that it should have been done then.
From our regulations, from the Act, this will go on up to June. And thereafter, we intend to begin payments or contributions at the rate of 2.75% with a minimum of 300. And our hope then is that access to these benefits shall begin from the 1st of July.
All right, so two messages at two different times, of course, two different meanings, but now the latest one, she says that she was correcting that. Honorable Ochieng, talk to me about the reality that we live in, knowing that the Social Health Authority has so much work to do. And I want to acknowledge the arrival of Senator of Murang'a, that is John Nyoto. Good morning.
Good morning, Sam.
Great. So, Mheshimiwa Ochieng, talk to me about, there's so much work if you to look at the 4 health laws, but also the regulations that you're talking about here. Do you think it is possible to deduct before establishing the systems, and what should happen?
Well, thank you so much, Sam. And I've told you here severally, the biggest problem we have as a country is something called sequencing. We got grand ideas, good ideas. You know, you could name so many of them, SGR, Galana Kulalu, now SHIF, and social health. Very good ideas. But we want to reach the end before we start the whole thing. We want to start at the end, not at the beginning. That has been the biggest issue for Kenyans, and every leader who comes in, you got these good ideas, but you don't want to make them mature. You don't want to let them grow organically. You don't want to make Kenyans walk with them. And I think that is the issue here. I personally, wholeheartedly, fully support the idea of social health care. Mm-hmm. It is the right thing to do. It's a way to go. But it's important that we get it right from the word go. And that's why, the issues being raised about, first of all, the sequencing of the reforms, the sequencing of putting up systems and structures on how this is going to be implemented is key. And that's why I personally want to follow the minister for mixed messaging. Kenyans don't know where this whole thing stands. And it's never been, it's not about money. It's about access to healthcare. And that's why Kenyans must be walked through and be walked with as we seek these reforms. You know, I belong to Kenya Kwanza coalition, and I would want that this very good idea be implemented with minimal hitches. And that's why, just to agree with the Honorable Bui here, that let's not put the cart before the horse. Kenya is not being followed up tomorrow in terms of health care. We have a system, however faulty, called SHIF. We've not stopped using it. We are not going to fold tomorrow. And so I want to request the minister, I want to request the PS, whatever they be, and everybody concerned with this, the health authority, that let this be done in the right manner. Number two is Kenyans up to now have not known what are the benefits, what is coming aboard. And so I would imagine that this next 2, 3, 4 months would be a situation where we are on a public awareness bliss everywhere. The county government is involved, the MP is involved, the MCs is involved. Everyone is able to tell Kenyans that this very good new social health system has the following advantages, following benefits, prepare to join it. And then all of us are mobilized, and this doesn't have opposition or government, in my opinion. Healthcare is neutral. All of us are mobilized and tell Kenyans, this is where we are going. So we take 3, 4 months, we check how many have registered. Then we can now say end of June, end of July, because you have these numbers and we think this is now viable, we start contributions. That's how I would go about it. And so I believe that the mixed messaging that has gone on should be stopped so that Kenyans get proper messaging on what this whole thing is about. From the primary healthcare to the emergency and chronic and the other things, the social authority system and all that, how SHIF is being transitioned by the authority and what is going to happen that was not happening before. These are things that Kenyans need to know before they are being told 2.75.
And as you speak about that 2.75%, I gather that there was no cap that was introduced. I remember the Cabinet Secretary, as soon as she started the public participation on the regulations, was saying that the rate is 2.75%, but if Kenyans say they want a cap, it will be put. There appears not to be any cap. And I'm just looking at the calculation. So 2.75% will be going to health insurance, 1.5% will be going to housing, 30% for some, taxation, 32.5% for some, 35% for some. If you do the math, then you're getting to, and this is just arithmetic, not accounting, that 9.25% of taxation, and you have not even factored in 6% of NSSF. I mean, what is the idea here? Because this is actually a burden, especially on those that are in formal employment.
Personally, I'll tell you, I'm not in favor of a fixed rate, like 2.5% of anybody's salary. We should have a cap on this, that, okay, the lowest is 300, and the highest would be, say, 10,000 or 6,000, whichever, the percentage is low. That's what I would propose personally. As to, okay, Sam, I don't want to mix the decision about healthcare and housing. It blurs the issues. It doesn't bring out what you want to bring out. That's what I would say on that matter.
No, I hear you on your personal preference, but is there any voice that would make that representation?
You know, I've discussed with you this whole things about, you know, the housing fund, now the social health levy and these other things. I mean, we always paid pay as you earn. It wasn't introduced by Kenya Kwanza government. We always paid pay as you earn. The only thing that was introduced by Kenya Kwanza government was the bands, as you now call them. And the bands, as again as introduced, if you know how Kenyans earn, very few of us are in the band of 35%, 32%, very few. And so I wouldn't want to get into the taxation debate this morning, because I want us to focus on this healthcare.
No. I mean, it's a fair question, because you see, we're at the moment of writing of the regulations. Debate is going on.
Yes.
Very soon they'll be gazetted and they'll become part of the laws of Kenya. Yeah. So they'll have the force of law.
And that's what I've said. My opinion, I've got my opinion on this matter.
And what are you doing with it?
That if, for example, and Mbui here knows what they do at the committee on delegated legislation, if it's brought to the floor of the House, I will propose an amendment to have a cap. Okay. Not 2.5%, not 2.75% globally, but up to some maximum.
I'm asking that because, of course, you're right, that there are very few Kenyans who are into the bands of 32.5 and 35%. But there are a few Kenyans that earn some 10 million shillings in this town. So you can imagine 2.5% is 275,000 shillings every single month.
That's my point, really. That's my point, really, Sam.
Yeah.
That up to some point you must agree that, yes, the low is 300 and the highest is 10,000 or 15,000 or 20,000 for that matter, and we cap it at that.
Okay.
I believe that is important. Otherwise, like someone said earlier, then again we end up with a fund that has so much money and you invite scandals. Yeah. So I think that has to be moderated.
Yet, in the end, Fred, what you're trying to achieve here is service, not money, really.
Correct.
You're trying to improve the health care services. I don't know, what are your thoughts about this? Because it appears that the government is keen on having it in force as soon as possible.
Thank you, Sam. First of all, it is important to understand that healthcare is important to all of us. And it's a provision of law that actually a socio-economic right. And we all agree that we need good healthcare. Now, if you look at the objectives of the regulations, first of all, they are to provide primary health care. Then they are to provide the social insurance fund, then they are to provide ways of registration, and so on and so forth. But now, when the Cabinet Secretary Health changes tune midway, it means the main agenda was to go into the deduction without registration, or rather without proper framework for registration, proper framework for providing the insurance, and a proper framework for providing for the primary health care. And therefore, I think the Cabinet Secretary, number one, must listen to the people. Sometimes I wonder, not to pick on her, but I've listened to her a lot of times when she speaks. While she might assert authority as the minister, but she forgets that some of the things she says require consultation. I think if I listen to President Ruto recently, he has always said that they would want to listen to the people. I would want to ask the Cabinet Secretary also to listen to the people. But these regulations, if at all they underwent public participation, then it is important to also to factor the views of the public. I'm not sure if the public would agree for a deduction to be done without them knowing the actual provisions of that regulation, even the actual provisions of the Act itself, the parent Act. So in my view, maybe the minister should take time and take the public, the minister and the team, take the public through the regulations. What is expected in terms of promotive services, curative services, preventive services, referral services, because people still don't know. Number two, in terms of registration, who qualifies? For those who are working and are salaried, what is expected of them in terms of registration, in terms of remittal? For those who are not salaried, even if it is 300 minimum, is it 300 minimum? Is that what is called, referred to 75% of their income? Because it's not clear. So I think there's a bit of bad messaging, and then there's a lack of information. But I would blame the Ministry of Health, headed by the Cabinet Secretary. And because she has not come out strongly to defend her messaging, she will be faulted largely, not only by the opposition, but also by the government itself, or the members of parliament who support the government of the day.
Interesting. Senator John Nyoto, what do you think? Okay, let's first listen to the Cabinet Secretary explaining some of the work that is needed to be done before rollout of services.
So our projection is that from this month of March, we need about 3 months to prepare ourselves, because we need a system, a digital system to do registration. We need to test it and then collect resources. But effective the new financial year, which is July, now Kenyans can begin to access services under the Social Health Authority.
You know, it's confusing that she should actually acknowledge the essence of procuring a system and testing it before rollout of services, but she still wants to collect the resources now. I'm wondering on what platform. And Fred also raises an important question here, that if you're saying 2.75%, I mean 300 shillings is the minimum, is it 2.75% of something? And I'm doing the calculation, it would appear 2.75% of 10,909 shillings would be 300. So I'm wondering whether that's the minimum income in Kenya. What are your thoughts about the implementation of this program?
Thank you, Sam, and sorry I came in a bit late, and so I was not there when you exactly began talking about this. But I think this social health insurance is a very exciting idea, and that is why maybe the CS thinks and says, I mean, wants an early implementation of the same, especially because it covers some things that NHIF has not been covering, like that emergency, chronic, critical illnesses, this primary health care. And so it's a very good, once fully implemented, it's a very good insurance arrangement. But I think, like all my colleagues have said, I think we need to listen to the people. I think we need to see what the concerns are. Because anybody would have a problem with starting making contributions before the rollout of the services. And so I think, well, that is something that I believe it's not too late. That is something the CS and the ministry can still look into. But I think Mheshimiwa Mbui said that we are collecting more money, of course, under this fund than we have been collecting under NHIF, which is true. The only thing that maybe I would want to say is that this is much, much better, because NHIF, only a few people, not everybody actually has been a contributor. And so many people have been left out of NHIF. And of course, according to the regulations, according to the proposals here, then even people who cannot afford to pay anything, there will be, government will actually pay for them through allocations that the National Assembly.
So if we begin the contributions in March, when does government make allocations for that?
Well, I think the concern for registration is a very genuine one, because we also need to know exactly who cannot afford. I have gone through this and I've seen they have what they are calling means testing measurement. And I think we need time to establish who exactly has what means, who exactly would government pay for. So I agree with everybody that we may need some more time. But I think everything else in this particular arrangement is very good, especially because it covers everybody once registration has been done.
Let me ask you, in your assessment, how much time would be sufficient? Because the Social Health Authority has to establish itself fully to recruit staff, to procure the systems that are required, hospitals and service providers to test the new system and see if it works, for people, all the people to be registered, and of course, there are other things that need to be done so as to know where you access your services. How much time would that require?
I think I've seen that they are taking over all the services that NHIF has been offering. And so services will continue for the people that have been contributors to NHIF. And I think there is, it has given itself a period of 1 year to have the NHIF completely get out of it.
That's what I'm asking, because now we're in March. The gazettement was made in November last year, so the 1 year lapses in November this year. So that gives us about, is it 9 months or thereabout? No, it's not 9. It's 8 months, because we're in March.
Yes.
So how much time is sufficient, really?
I think if people ban the midnight oil, we still can be able to meet the deadline of November. Why I'm saying that is because if we were to take all the people that are covered under NHIF, then the registration, and I mean, the registration of those that are already under NHIF would not be such a big deal. So we would then be talking about...
But they have to apply. Mheshimiwa.
They have to apply, yes, but...
you cannot transfer data from NHIF to SHA.
But I think it's easier, Sam, because these are people that are known. We have data relating to these people. I think registering them may not be as big a problem as registering those...
But the law and the regulations talk about every person applying to the authority for registration.
What I'm trying to say is we have known contributors to NHIF.
Yeah.
It's very easy to mobilize them to apply and be registered. The biggest problem, in my view, would be, you know, reaching out and having them register those that are not registered under NHIF.
Okay.
But those registered under NHIF, I mean, it would be very easy, even using the current structure under NHIF, to mobilize them to apply so that they can get registered.
Yet
in my view, that would not be...
Yet we are doing away with the NHIF and all the stuff there. They have to apply if they want a job.
No, but some people...
No, can I just clarify?
Yes, and I want us to take a break.
On the regulations,
yeah,
that they are very specific that everyone, including those that are under NHIF, must be registered afresh. Correct. And everybody must apply, and everybody must have their biometrics taken. That means it's physical appearance at a registration center. Correct. And every Kenyan, including children, and everybody living in Kenya must also be registered. So it's not something that we can do within a day or two.
Okay.
Yeah.
What was the interjection, Mheshimiwa Cheng?
No. You know, there are things that I think we don't have to fight over.
Yeah.
Like, for example, what he proposes. We don't have, I mean, even as you speak, we had a law that was made that makes transitional provisions on how things are to be done. What is intrinsically wrong with just moving those currently in NHIF into SHA? There's nothing wrong with it. If it's going to make the decision easier, I don't see anything wrong with it. I mean, Honorable Mbowe, Honorable Newton, and I are currently enjoying a very generous insurance package in Parliament.
No, I didn't want you to get into the details. I just wanted you to tie that point of...
This thing of registration...
You're asking the question, what would be difficult or what would be the problem of moving those under NHIF?
I don't see nothing intrinsically wrong with it, but what he says is important.
But when the law says apply to register, for instance, let me ask you, if you're doing the voter registration and there's a mandatory fresh registration, can you move data from IBC to a different system?
Of course not. Of course not. But
why would you do the same in health?
The point here for me is, that's why I didn't want to make it an issue, is semantics, really. What you want, which has not been happening in NHIF, is that you want every Kenyan to come aboard this system. So for me, any way or means that makes every Kenyan get in the system, for me, is welcome. That's the point I'm making. Any way that makes, because at the end of the day, you want every Kenyan to be in that system. So whichever way that makes every Kenyan...
NHIF doesn't have our biometrics.
They do.
They are required.
They do.
Not mine.
But even if they have...
They do.
Even if they have...
They do.
If you look at the management of NHIF, Sam...
They do.
The mismanagement of NHIF, we have seen corruption cases being reported as a result of mismanagement. So for us to get it right from the start, we must first get the correct data. we must first register the actual persons and then proceed.
Okay.
We cannot transfer that data from NHIF
to social
housing authority.
Health authority.
Because what? Because NHIF is from Uganda or from another country. It's the same Kenyan, Sam.
You know what about check?
This for me is too much heat, no fire.
No, that's a shortcut that
And
will
the heat
lead to
can actually
corruption.
kill. Look, Honorable Cheng, you passed a law, and the regulations that are being considered are stating that every person shall apply to the authority for registration. It doesn't say they shall transfer the data from NHIF to...
You're speaking about the same thing, really, Sam.
No, we're not.
Because you know, okay, let me agree with you. Let me agree, Honorable Nyuto. Let me just say that let every Kenyan register afresh with the social health authority. Correct. If he's going to make it easier for you.
Let's take a break.
This is just about...
Honorable Cheng and Senator, let's take a break. We come back with more, specifically on the question of, is it handshake season 2? Stay tuned.